Yes. Hi.
Yes.
Okay, great. Okay, Assalamu alaikum. Good morning, good afternoon, good evening, everyone. Thank you for being here and for choosing to spend your time in conversation about Sudan. My name is Azza Osman. I'm a Sudanese community psychologist and co-chair of the International Committee at the Society for Community Research and Action. Moderating this session is both an honor and a deeply personal responsibility. Sudan has been living through a devastating war, one that is not only destroying infrastructure, but fracturing families, communities, education systems, and collective well-being. Civilians are dying daily. Children have been out of school for over 500 days. Women are facing systematic violations, and yet, alongside this devastation, Sudanese communities continue to organize, to care for one another, and to resist. Today's dialogue is not only about crisis, it's about dignity. It's about mental health as central to survival. It's about women not only as victims of war, but as peace builders and stabilizers for their communities. And it's about confronting the failures of international systems while amplifying the leadership of grassroots initiatives. We will spend the first half of the conversation with our speakers, followed by a space for audience questions and discussions. We invite you to submit your reflections and questions throughout the session into the chat bar. And you're also welcome to ask your questions directly to our guest speakers once we open the floor for that. This may be a heavy discussion, so we kindly ask that you hold the space with care and respect. With that, it is my privilege to introduce our speakers. First, we have Mrs. Sadia Rashid, a Sudanese humanitarian leader and the founder and executive director of Hope and Haven for Refugees, a grassroots organization delivering life-saving assistance for Sudanese displaced communities across Sudan and in Chad. We also have Dr. Sulaim Al Khalifa, State Minister of Human Resources and Social Development, a psychologist, GBV and MHPSS expert, formerly led the Unit for Combating Violence Against Women and Children in the Sudanese government. We will begin by having better context of the war in Sudan with Mrs. Sadia. So please, Mrs. Sadia. The floor is yours, Mrs. Sadia. Mrs. Sadia, can you hear me?
Yes, I can hear you.
Okay, great.
Okay, good evening, everyone, and thank you for opening this space for Sudan. Because for too long, Sudanese voice have struggled just to be heard. I want to begin with a simple truth. What's happening in Sudan today is not only a political conflict. It's not a civil war. It's a humanitarian collapse unfolding in real time, and civilians are paying the highest price. Since April 15, 2023, war has reshaped every part of daily life. Cities have turned into front lines, school into shelters, and hospital into empty buildings. Without medicine or staff. For many families, survival have become a day-to-day negotiation with hunger, fear, and displacement. In Darfur, the situation is even more worse. Communities are facing layers of crisis at the same time: violence, disease outbreak, food shortages, and constant moving of families fleeing from unsafe place to another. Entire generation of children have now spent more than 500 days out of school. Imagine growing up knowing conflict more than education. This is the reality for millions of Sudanese children today. And while we talk about systems and structure, we must also speak honestly about the human cost. Women and girls are facing systematic violation while carrying the responsibility of holding families together. mothers are working for hours to find food or water. Volunteers are running community kitchen with almost no resources, trying to prevent famine one meal at a time. What we are witnessing is not only displacement of people, it's the erosion of dignity. Families who once lived stable lives are now dependent on uncertain aid. Teachers have become displaced. Doctors have become refugees themselves. And yet, despite everything, Sudanese communities continue to respond, organizing medical camps, food centers, and safe spaces for children when the world attention moves elsewhere. As someone who worked closely with local responders and displaced communities, I want to be clear. Resilience is real, but resilience should never be used as excuse for international absence. Civilians are still dying. Children are still out of school. Humanitarian access is still restricted. And without urgent attention to long-term consequences for Sudan society will be devastating. So today, my role in this opening is not only to provide context, it's to bring the voices of those on the ground into this space. Because behind every statistic is a human story, and behind every humanitarian report is a community fighting to survive with dignity. If we truly want meaningful solution, we must begin by listening to those stories, honestly, directly, and without filters. Thank you.
Thank you, Mrs. Sadia, so much for this. Dr. Sulaima, I want to go to you because I believe a lot of people have misconceptions about the war in Sudan. A lot of people are saying this is a civil war, and a lot of people have a lot of misconceptions throughout the last 3 years and more. So if you can give us a bit of a context about what is happening, why is it happening, and who are the different parts involved.
Okay. Good evening, because it's Sudan time. It's evening, and I'm speaking from Omdurman actually. We are back, and this has not been. It was privilege and a grace, and we all the time thanks God for that grace to be sustained. Amen. Because we have been actually kicked out of Omdurman on the 13th of April. We don't have a choice. We left. I left with my children, with my mother, with my family, and we are actually displaced, not like other people in Sudan that have like their grandmothers or other extended family in other parts. Actually, our roots, everything is in Omdurman. So going out to White Nile was just a choice of convenience, not because your roots are there and you have a house over there. We are totally displaced we have been displaced now for 2.5 years. And now we are back from Durman. We have finally put our clothes in wardrobes because all the time we put them in bags. We never have this feeling of settlement. We spent a year and a half in Kosti and a year and a half in Port Sudan. But yes, it's still my home, it's still Sudan, but home is always Omdurman for me. And this is most of the people who lived in Khartoum or lived in Omdurman. They never feel that they are at home unless they are there. And even my children, reluctance not to go to school had just gone away because they feel it's like normal thing. They have to go to school, they have to wake up in the morning, they have to have a program, they have to do something like a routine. So it's finally, we are getting something, part of our lives back, some part of our lives back, not all of it. Because my home, actually the home I used to live, where my children lived all the time, is shelled. So it's not eligible for being used as a house now. It needs a lot of rehabilitation, check and assessment of even any engineers to see the effect of the shelling on the house. This house, my father's house, was built in 1923. And it has built by, I think there's an English team. It was a colonial time. And this house also witnessed a lot of phases of Sudan history till independence and after that. So it's not a destruction of a house, it's a destruction of a memories, of a legacy, of every wall that's witnessed something. And actually, we have a historical wardrobes that had been used to be my grandmother. It was one pieces, and we have a historical things that we lost forever. The people who used to live in the house after the Khartoum was free, because some people come from other neighborhood to stay in our houses. They burned actually most of wardrobes, most of all historical, because not all the luggage are there. Most of it has been looted. But actually the remains, which are historical items, used to be like as a legacy for the family, was burned as used to be as a fuel. So you can imagine how, because the reality of this war is not about, it's not a war between two generals. It's not a civil war as Saadia mentioned. It's this war, the moment it started, it targeted us as a Sudanese people. I have witnessed a lot of things in Khartoum before departure. I never saw a soldier against a soldier. It was always a soldier against me, my existence, my whole being. It's my property, not my only property, of course, but as a metaphor, I mean the whole Sudanese people. As a woman, all of us knows that how it's difficult to be used as a weapon of war. Our bodies to be used as a weapon of war. There is no differentiation of age. A woman of 85 and a child of 1 year could be targeted because it's used as a weapon. We are just items. We are just tools. We are not even human. We lost our humanity and lost other things. Women who have been saving for because Sudanese women have been actually supporting themselves and fighting poverty by their own means, by their strength. They have been looted from all their properties, their savings, everything. And you can imagine the economical violence, how it affects us as women and as girls. This is just, I was trying just to give you a glimpse.
Dr. Sulaima, I
And
remember a lot of people when the revolution happened in 2019, a lot of people were telling me now that what happened? You guys had a revolution and you were very happy and you were
we have been
standing
praised,
up
and we
for
have
it.
been, people
So
talk
what do you think
about us
happened?
as icons. I don't know. The world just turned its eyes on us. They ignore us. We have been their icons. We have been an inspiration for the whole world. How Sudanese women, people are celebrating us. And then when things happen, people just ignore what's going with us. Even in 2023, we faced the most betrayal because most of the time people are not talking about Sudan intentionally and even ignoring who's doing this to us. And this is hurt, actually. For somebody I came from the government, from civil society. We always believe that international community will always be with you. We believe in all these kind of principles and things that have been always taught to us about democracy, freedom, peace, and then one day we have been just left alone. I always feel that we are just alone, and I remember those moments. It always the moments. The first moment when I see people departing, even more organizations, UN, everybody was just departing Sudan. Nobody's there. When I went to Kosti, White Nile, there is no international organization working on or UN agencies, only some nationals who didn't even provided by decision making, who could actually to support people. They are just there. They don't have the power of decision making, of making any kind of interventions. They're just thinking. We are just thinking. They're thinking without any kind of fund of support. We don't have money. We didn't have anything. But the Sudanese community have moved first. It's always like that. We know that in every crisis, the community will always be the first front line. And then will come the government, and then will come the organizations. And Sudanese community have been containing all this for a very long time since the outbreak of the war, shouldering the most of the difficulties. And I don't just talk about the community members, even the people working in the government. I saw that in the White Nile. They have not been provided by their salaries for 3 months, and they have been hosting displacement as well. So their families, they have been hosting more, like one house could have like 20 family. You can imagine that? Somebody who have no salary, but they still work and they still volunteer and they still provide free support for pregnant women, for example. They still provide free psychosocial support, and social workers have been working like bees. They never stop while they're not even paid. So you see, yes, there is a shock of what's happened, but people has been actually looking at us with like, those are the people coming from Khartoum, we have to support them. And I remember also the time that when we were in White Nile, and then the invasion of RSF to Jazeera. A lot of people in Kosti had left. That's remained only the internally displaced people, either the people who are renting houses or people in the shelters. We are only the people there. Banks are closed, markets are closed, and we are expecting every minute that RSF will be there and demolish, because we know that when they are there, every humanity will be demolished.
Dr.
Either
Sulaim, I
by,
think we're gonna mention RSF and SAF a lot in this conversation. So if you can clarify to our guests what we refer to when we say RSF and when we
look,
say SAF.
since 2003, I have never called RSF something more than Janjaweed. I was in Darfur in 2003, 2004, 2005, 2006. So it's always remained the Janjaweed all the time. Because you can never get that out of your mind where you have been witnessing such atrocities. And even when it become, they are part, yes, of government, and we have to talk to them, but it still, we have this kind of things that prevent you to have this kind of normalcy around them. So they are never being trusted.
We are referring
You're
to the
always
rapid
having
support
this,
forces.
the rapid support forces. Yes, we have been enforced to take them as a formal entity, and we have been that it was imposed as Sudanese, by the way. It was not something we like, but actually because after the revolution, and then people have been signing all these agreements that we didn't like, and we are part of also of the government, we have to to work on those compromises. And I hate compromises. It's ugly. And I think what I learned from this war, there's not going to be any compromises anymore. What I like, I like. What I don't like, I don't like. Maybe for the benefits of the people, for the whole things, you can just, you have to work and provide. But actually those are essential things. If you keep silent about them, this will happen to you.
A
And
lot
it
has
was a
happened.
lesson. It was a hard, very lesson.
A lot has happened in the last
Because they
few
were
years.
supported, by the way, they have a privilege. And the real governance of Sudan before the war is actually Hemeti. I don't know why he's doing this. Nobody even understand why he's doing this. He's the actual governor, by the way. He have all the powers, all the money, everything. And
But it's still not a civil
yeah,
war.
but it's
So
still not a civil war.
can you
He
give
has
a bit
been,
of context about the regional players that are at play? Because
yes,
a lot of people have this
it's
misconception.
we have been a privileged country because of what we have, but this makes us as a target for all the greed of the whole nations. Red Sea, the gold, other mines, other things, uh, agriculture, everything. Sudan is rich beyond our understanding, and sometimes I feel is it a grace or a curse? Now it's a curse because we are being target for the international greed, and interest of people will always be over our own interest. Our well-being could be compromised by other people's interest, because and it will not win. We are not going to win this to others. We know that UAE have the upper hand, and have the upper hand above the whole world. Their power and their money makes everybody silent, and this is a shame. It's kind of shame that people, because of the money and interest, they're ignoring human suffering, women, children, people killed all the time. And we as a civilian, we had paid all the whole prices. Women, children, men, and even the legacy of Sudan, the history, everything. It's like erasing us as a nation. But we remain.
You mentioned, Dr. Sulaima, how we have been very disappointed in the international community and the lack of support that was provided throughout the last 3 years. But I believe Mrs. Saadiya gave a great example of how grassroots initiatives and how Sudanese communities came together and are still supporting
resilience
till this
and
day.
strength.
Exactly.
Yes.
So I would love
This is
to hear
Saadiya's
more
space
about
now.
it. Yes, I would love to hear, because it's great how they are able to fill such a huge gap with these interventions, and with the support of the Sudanese expats and the community internally and
diaspora
across the world. So yes, the diaspora. So I would love to hear more about this, Mrs. Saadiya.
Thank you so much. And Sulaima, what she said, and by the way, I salute you, I salute your courage. This is what a Sudanese woman. She always smile, and if someone went through everything she mentioned, you will not even have the strength to just to put on a smile. But as Sudanese woman, what you can do is just put on a smile and go on, continue your work, because so many people are depending on you. And unfortunately, you are alone. You are alone facing this war. We are alone facing everything. Let's be honest. We are forgotten in this war. This is called the forgotten war, and this is what's happening in Sudan. This is a proxy war. Proxy war, like we have lots of people who are interested in our country sending their troops and fighting on their behalf. They don't even have the courage to fight their own fight. They are just encouraging this militia, and I call them militia, and they are the RSF are militia. I said in front of them, in front of the whole world, they are Janjaweed. Janjaweed is a demon, or they are devil on horses. That's what they call them in Darfur, because that's what they've been doing for the past centuries. That's what they're doing, killing people. Everything they've been doing right now in these 3 years of war, they have been doing it in 2003 and be doing it in Darfur. Yeah. Before I move on to the next topic, I know the world, sometimes they want to hear numbers. Let's hear this shocking statistics. I just want to read it so you can get the idea. An estimated 3.2 million children under 5 are expected to face acute malnutrition in Sudan. More than 800,000 children suffer from severe acute malnutrition that threaten their lives. Recent estimates indicate that acute malnutrition cases may reach about 4.2 million in 2026. In some areas of North Darfur, acute malnutrition rate among children have exceeded 52%. More than half of the people in North Darfur areas, more than half of these children have acute malnutrition. In other areas, the rates have reached about 34% of children. Around 1.3 million children live in areas classified as famine or at risk of famine. More than 24 million people in Sudan face high level of food insecurity, directly impacting the children. These are statistics made by the UN, and these are recent statistics. And the truth is more scary and more devastating than what actually happened, because they don't even have the courage to go and check what's happening. Up until this day, there is a city called Al-Fashir. No one knows what happened to the people inside unless the RSF led them inside and, of course, make them see what only they can show them. We were talking about famine and what's happening in these areas and what's happening to the people. And we have in this war, we have two major massacres, like Al Junaina massacre happened. Everyone was silent at that time. I know how this feels, because you were trying to scream and saying to the whole world, our country we are being wiped, we are being killed, and the whole world is just turned silent. There is a massacre going right now. That's why I made the hashtag saving Al Junaina when the massacre happened. Unfortunately, it's turned to saving all Sudan, because all Sudan is now needs saving, not just Al Junaina. Then comes the massacres of Al Jazeera, Wad al Noura, all of these areas that faced lots of atrocity and lots of injustice. And now Al Fashir and what happened to it, it wasn't even far. So I want to talk actually about something. Most of the people who are working humanitarian, they don't find a space to talk about it, because it's the complicated, and how it's really complicated to work and to get funds from these international organization, and actually the gap they are providing, what actually happening on the ground and the promises they are making. We often hear like the WFP, the UN, these people are providing lots of support. They are willing to provide lots of support, but we see nothing on the ground. And local organization, and I'm talking here about Copenhagen, and I'm talking as example, I'm talking about emergency room. You are asked to meet funding requirements. It's not designed for crisis. Unfortunately, when the crisis happened in Sudan, they didn't adjust their system based on the crisis happening to us. No, they try to force us to adjust to the system they are providing. Otherwise, they will just ignore you and simply will say, and I heard it and I listened to it many times. I received this reply many times. Sorry, funds for Sudan are limited. The worst humanitarian crisis in the whole world. Unfortunately, we have limited resources for you. We are asked for a complex reporting system, layers of documentation and compliance structure. These need, at least, you need to have stable electricity. You need to be stable. You need to be living in a safe place to provide this. When I tell you I have someone who's dying tomorrow, or gonna face a lot of problem, if they don't provide, they don't get the treatment, or they don't get their meals, or they don't get the attention, and you telling me, please fill out this due diligence or complex reporting system so we can look into it. And not just that, let's move on to the complex bank system. Like we had funds that took us 6 months to reach us. 6 months interval. How many civilians have died in these 6 months? Millions. So yeah, this is what's happening. And unfortunately, the people who are supposed to, like we are the one in the front line, the one who are facing the shooting, the fire, the one who are working, because this is our community. We're trying to help our people. We are trying to help our community. Unfortunately, us are not the one who are getting these funds, and because of that, because of all of this complicity, we end up losing the funds. Or if we get the fund, they will treat us not as partners with them, they will treat us as executor for them. despite everything we're doing. Application, as I said, may take months. Communities need attention now. We're talking about, in stable communities. Let's talk just about the stable one. No, we're not even talking about where there is still war going on. People are still depending on these community kitchen. They are depending on the meals that are provided by local organization, by the people, Sudanese people who are living abroad, by the crowdfunding, by these influencers who are so amazing that really helping us and share and talk about Sudan and get these funds for us. They are really dependent on these single meals. When you talking to these people and you're telling them these funds are like it need to go through structure, it need to go through complex system, why aren't you adjusting for the crisis that's happening with us? We feel like what's happening to us is really injustice. And we can go on and talk about this, but I don't want to just look at the negative part. The platform you are opening right now, the internet actually, and the fact that this war happened during a social media revolution and during the opening of the internet and communication, this is how we manage to get this minimum amount of funds to our people. This is how we get to help lots of people. It's a blessing actually that, and it's a blessing that so many people right now are freeing up their time just to hear about what's happening in this part of the world. So I salute everyone who is willing and who have a space and who have give us time to talk about what's happening in Sudan, to listen to our story and try to help. So many people, so many volunteers are coming from all around the world and talking about Sudan and providing help for Sudan. I get so many emotional messages about small businesses that are trying to provide help from their own profits. They don't even have big amount of profit. Just imagine if the big ones, if the big organization, if the big companies offer the same way, then we will not facing the same problem. But the people are always, we are relying always on the people, not at the government, because the government, they were not with us. We're relying on the people and the way they're helping us and the way we are sticking all together and connecting together. So thank you for coming and listening to our stories. I'm not sure, Azza, are we going to talk about the stories from the ground now or just move into it? So you can enlighten me on this part. Azza, your voice is...
Sorry, I was muted. I was saying that we can hear a bit about the interventions that Hope and Haven are doing, and also the emergency rooms and the daily kitchens. I think if we can get a glimpse of how little and small amounts of donations, like you said, from individuals, from Sudanese people inside and outside Sudan, how can it be translated to the things that happen on the ground that keep people surviving daily?
Okay. So I will just share about Hope and Haven because I want people to know about us. I made this small presentation about Hope and Haven. I want to share with you. This beautiful picture is from our trauma center. This is in Adre, Chad. This is tell you about how we are as a community still trying to dress up, dance, and have some fun in terms of the war and everything happening. So we are a community-led humanitarian action, and we are aiming to save life in Sudan, Chad, even in Uganda. We're trying to provide through food security, healthcare, psychosocial support, and dignity-centered intervention. We talked about the war and these are pictures of displaced people, and this is actually how everyone, mostly everyone in Sudan, flee during the war. Like some people even with nothing, just like Suleima talked. Where we work in Sudan, we work in North Darfur, mostly we work in all Darfur region except the South Darfur, because of the in South Darfur, except in Al Junaina, because after the massacre, we worked with the communities of Al Junaina, who fled to Chad, the Adre refugee camp, Al Malik camp. We provide also in White Nile area and Al Jazeera, Khartoum Bahri, and East, South, and North Darfur. Our model of intervention is we provide life-saving and food and nutrition, health and medical access, protection and psychosocial support, community-led implementation with local volunteers. We are fully dependent on our local volunteers, from the volunteers to our community. We have community kitchen, and we served over 30,000 meals monthly throughout our community kitchen, more or less, of course, because that all depend on the fund. Daily meals for displaced families in Tawila, Korma, or food parcels. These are the things that we can provide. We have emergency kitchen. We had emergency kitchen responding to what happened in Al Fashir, displaced people. And of course, we provide Ramadan and emergency distribution for across, not just Darfur, across all Sudan as well. As I said, we provide food basket and parcel distribution. These are this is our scale of support up until the 2025. 2,040 families reach 11,607 individuals. Our major distribution was in the Banaira camp, Korma administrative unit, East Darfur, Tawila, Zamzam camp, Kassab, and Abshok. We prioritize pregnant women and children. We have a medical and health intervention. This picture is from Chad, from Adre Chad. Our team supporting cholera response in multiple localities, infant nutrition support, medical clinic, that's the one in Chad, providing up to 50 to 75 patients daily. When hospital collapse, community clinics become the front lines of survival. This picture is from our trauma center and women protection, and we are proud to think about the trauma and the psychosocial support during the war, because unfortunately this is considered as just a luxury. But we care about our health, and we care about the people's health, mental health as well. So healing trauma is as critical as feeding hunger. We also provide wash infrastructure. We have water pump serving. We have water distribution campaign, hygiene kits for displaced women and girls, environmental sanitization during cholera outbreaks. We care about the education, and this has actually happened last year when the people went back. And this is a classroom, by the way. I know doesn't look like a classroom, but these children are trying to go back to their normal life. They try education, and they are just going. So we provided with daily meals for them, and in order to support them, we provide also with school supplies. We provide them with we even reconstruct schools, because the schools were targeted during the war. And education is a protection. It gives children a reason to hope beyond war. We are a community-led approach. That means the local helper implement programs. Women and youth committees lead targeting. We are depending on our youth, and we are depending on our communities. Partnership, we also partnership with local organization. We're not just keeping the donation for ourselves. No, we share with all other grassroots organization, with all other small initiative. We try to provide as much as we can when we get funds. Of course, we faced lots of challenges. One of them is the limited funding, which is a huge problem. The health system collapse, the cholera outbreak, then the dengue fever outbreak, then the malaria outbreak, seasonal rains blocking access routes, rapid displacement beyond the capacity. We faced a lot of challenges and we're still facing them. But why our model work? It worked because we make sure that it reach the people. We are present on the field, and we make sure that our operational overhead stay low. We're a diaspora driven support. We get our support from the people who live abroad, and we are integrated in multi-sector response because we are making this system that we are work all together. You have tens of thousands of meal monthly, thousands of families receiving our food basket, medical support across multiple Darfur facilities, refugees, trauma center in Chad operational. This is our impact. I just want to show you this small video. It's not very long. This is from our safe space in Chad. These are the children who are in Adre, Chad, who are enjoying the safe space, and it's one of the things that make me really always look up into these children, because these are the new generation. We need to look at them, because if we lose them, we're going to lose our whole country. And if we can provide a simple thing like just this little joy, just by listening, by sharing, by donating, if you can do any small thing for these children, because they deserve the whole world. These children are unfortunately living in unfortunate areas, and they need all the support from us. Yeah. I want to share some of the stories we faced, and some of these, like the challenges, and a story of hope, not just challenges. Also, show you how much we care and how much we act and how much we do on the ground. We have so many challenges, especially when you send money from abroad to Sudan. There is no banking system. So we go through lots of trouble just to direct this money to Sudan. And the danger itself, when you are outside, is the most thing that happened to you. You can get into trouble for trying to access money to Sudan. But the people in Sudan are the one who's facing lots of danger. The one who are our workers, when they found them with cash, and we have many cases actually, they found them with cash, and unfortunately they get attacked, and then we have to evacuate them. So they faced lots of problem trying to take these funds inside. So it's not just about sending the money to Sudan, also trying to put this money into places where it really needed. I'll talk also about the survivor. We have a very emotional story about, and she's a survivor from the massacre that happened at Wad Noura. She's a widow, and she lost her husband along with his brothers, and she lost also family members. And now she's working as a kitchen manager for one of our community kitchen. and she's providing for her children, and she doesn't need to beg for money anymore. She's now like a leader for this kitchen, and this is happened because of the system we made. Like, we try to empower people. Talk also about the survivor of the massacre that happened in Al Junaina, and she's actually was unfortunately sexual abused, and she came to Chad on foot for days, and she managed to reach our trauma center, and she went through 3 months of sessions and rehabilitation and everything. And fortunately, she's now been able to tell her story herself. And not just that, she's strong enough to know that this is not her fault, and she can also speak to other survivors and tell them they can to give them encourage to speak for themselves and to do more things through all our programs. These are stories not just of displacement and war. It's also a story of hope. So we're trying through Hope and Haven to provide the hope in this hard time. Thank you so much.
Thank you, Mrs. Sadia, so much for all the wonderful things that your organization and all initiatives are doing on the ground in Sudan. I think you talked about the role of women, how even though they are facing devastating circumstances themselves, but they are still leading. They are the stabilizer for the community. They are peace builders, and they're playing such a huge role. And I believe I would like Dr. Suleima to share with us more about the role of women, how they are surviving this, and how they are taking care of their communities, their families, their children, their neighborhoods. And also, even though it is hard, but I would like to know more about how they can be supported as well, because this is a prolonged crisis. There has to be a psychological impact on the communities and on the women, because they are handling so much more responsibility.
I thank you, Sadia, for your very inspiring presentation and for the great work you have been doing. I always say that as a Sudanese women, we don't have, or all women, they don't have the luxury of getting the whole process of their pain. They don't have time to get depressed, look at the ceiling, and comply to their feelings about not joining or doing anything, which is normal and this is their rights. But actually, because there's huge demand from the community, from their family, even if nobody told them to do so, but it's something by default. Sudanese women held this kind of responsibility. When women and men and children they came into shelter, women will always take the lead of making this as a stable as home, a home-like place, because they always try to normalize the whole setting, and they're always trying to make something that actually looks at their normal life, because they cannot operate when it's not normal. And they always do the cleaning and preparation, and they try it's actually their fault by default role is to actually to tell people that to restore back their lives and to restore back their capacities to adjust and then to survive. So women will always the core point of survival, the core point of adjustment, and the core point of rehabilitation and restoring lives. And women also that is the backbone of every societal peace initiative or societal peace and intervention. They do it by this just by default. It's not something could be organized. It could be something that they just do voluntarily without somebody actually asking them to do. So women have always been the people that you can rely on. And it has been very much different during providing support to the people in the shelters. when people are trying to have support, people getting the support, providing the support from outside, because they deprive the people inside the shelters from their own control over their own lives and decision. It doesn't work. So finally, people are agreed, or they have just finally get the conclusion that the same displacement population could be helping their own self themselves from their own people there inside the shelters. So that's provide women inside the shelters with much more power and much more dignified support, because you cannot decide for the people because they're just displaced. So they become volunteers in the child-friendly spaces, in the women's spaces. They have been doing supervision. They have been actually getting much more roles and responsibility. Those are internally displaced people, but they have been helping each other, and some women find they have much more strength to support others as well. So I saw them as leading this is something um, uh, uh, that need a lot of capacities, but actually they do it because they cannot survive by just waiting for somebody to help them. They want to help. Yes, they need help, but they want to help others, and this is make a difference. This also a lot. And we have a lot of initiatives that made by women. Even women survive it, by the way. They are helping others who have been going through the same experience. Yes, those are initiative cannot be advertised or people talk about it in the social media, but actually I know about it and how it effectively support other people more than even sometimes specialized helpers. Yeah, the support provided by survivor to other survivor is always huge and real, and provide a lot of lessons, and actually because it's come from experiences, and they feel that they went through the same experience, they understand each other much more. So those are things led by women. We still have yani, during the very hard time in places where in active conflict areas, those are not the social workers, the case workers who are volunteers. They're not working in organization, they're not getting salaries, they're just volunteers who accompany survivor in each support area they need. So they accompanied them to the medical support. They accompanied them sometimes if they want to file. In those places, there is no police because it's not stable, but at least they could support them to get the psychosocial support, to get to the all services, because sometimes it's very difficult for a survivor. Actually, not because the service is not there, but because they don't have the power to get to the services. They need support and they need somebody to accompany them, and because also they lost trust and they are very very scared, their emotional status and psychological status prevent them from doing this by their own means. So getting those case workers always was a privilege, and I'm really proud of those girls. And because sometimes they have cross areas where it's actively, and then sometimes they get interrogated, sometimes they get stopped by authorities, either authorities, both authorities, and accused as somebody who moved from one place to another to be a spy for for staff, for army, for example, all the time accused by the militia of being spying for the staff. And those women and girls have actually risked their own lives, risked their own future by providing support to other women. Their support was powerful, their documentation was very much strong, their capacity to advocate for women support for women's safety and security was unique. And they're still working in safe areas, but their interventions has went through other things as well. But you see how much heroic their role in the times of where there is nothing. The other thing, you see women, even surviving this war, they're still leading their social role. A lot of women now are actually head of household. And now they're trying by any means to get, and this is not just in Sudan, even the refugees in Egypt and other areas as well. And this was something happened that most of the men, for example, in displacement, most of them remain in Khartoum, and women actually displaced themselves in Jazeera or White Nile and other areas. And then they took the whole responsibility of their families. And this is happening also to most of the refugees. We see that women and the children. And most of the young women who have been working have been actually responsible of their families and extended families, by the way. Uh, uh, well-being and actually also getting to the services, getting money for food, for housing. Even they have been responsible of the decision of is it time for getting out, going to Egypt, and going to Kampala, going to Nairobi. So women and girls who have been working, they have been exhausted all their resources and all their well-being on giving solution to their families member, to their family, not direct family sometimes, because in this war in Sudan, maybe you use to support your direct family, but after the war you support everybody, all friends, family member who's not very much related, people you know, people who used working for your family, for example, neighbors, who feels a little bit getting something or having salaries, they share everything with others as well. It's not just the diaspora only, but even the people working in Sudan. Most of the time you are demanded by the society and then you give because you don't have any choices. Because the war have been actually impoverishing people, because people have been able to do things for themselves, getting medical support before the war, now they cannot. And you feel ashamed that you cannot help and support. Because I think those kind of principles are embedded within the Sudanese society. Like you cannot keep silent from other people's pain. You have always tried all the time to share. And I think those are the things that remain stable even when things are changed, and even you see some kind of ugliness within the society itself, but at least those kind of principles and those kind of social norms have been remaining the same, that you are supporting others, and you feel all the time that you have the responsibility. You cannot deny this, and you cannot say I don't care. So this is mostly women and girls on this front line, and it's very exhausting, by the way. Even women who support internally displaced women who choose to support other women, it's also exhausting for them. So this is kind of stories that happened, and this is kind of resilience is there, but we need to invest on this resilience, not to just let it like that, because we're not there processing their pain today, but it could be accumulated, and one day people will explode because it's too much. And survivor who didn't have chance to have all to process their pain normally, one day they will face difficulties, and this is going to be a generational trauma going for years. And that's why we feel that mental health and psychosocial support is one of the main pillars of survivor and restoring back lives. If people are talking about rehabilitation, restoring back lives, and we're talking about like going back, doing things, and actually keeping on hoping that the hope that Sudan is not destroyed, we still have a country and we want to build that country, we cannot do that without psychosocial support and mental health. It's essential things. It's not a privilege. It's not a luxury. It's a priority. It's the same thing so it cannot also done without basic needs. So it's the whole pillars of the triangle. It's the whole pillars of the pyramids. It's a safety, security, and above that, before that, it's also the basic needs of food, shelters, and water, and sanitation, and then you go to the safety and security, and then you go to family affiliation, community, and then you go to the specialized support. Yes, we have been going on all this through. We know that not all the people are traumatized, but we know that not only 10% of those people will need specialized support. That's we need to invest on the minimum standard to be supporting the people, investing that even the essentials are provided on a matter that promoting mental health and psychosocial well-being, because basic need is essential. I remember that during the first time of a displacement, all the organization they want to do psychosocial support. They don't even have money. So they go to do psychosocial support, and they ignore the fact that the children have been hungry till it's noon now. They didn't get the breakfast yet. People are preparing it, but it takes long because it's for a very large amount of people. And I said to them, you cannot do psychosocial support for hungry people. And I can understand if the society or the community in this shelter or this particular shelter will kick you out because you did not respect their own humanity and you did not respect their dignity. That hungry people, they are not rested. They need to have others' essential survival needs. This is psychosocial support. People feel that psychosocial support is something you have to sit in a sofa and talks about your past. Psychosocial support is services, dignified services, is actually information sometimes, and it's actually the ability to perform their cultural and traditional maybe ceremonies and traditions or even rituals. So people don't understand psychosocial support as a manner of the whole umbrella of survival. They thought it's something that they can provide by activities, and this is not. We always have been trying to correct this kind of notions and to let people understand how basic needs support the psychosocial well-being and mental health, and how the information and how the dignified support and how small interventions. So it's actually a challenge, but for the fact, it's one of the resilience stories. For the fact things, I have to say that psychologists and social workers all around Sudan have been in interventions online or face to face since the day one of the war. And I have to salute my colleagues and have to say, may Allah bless the souls who lost their souls during this, because Al-Fashir Trauma Center, for example, have been working till even the destruction of the hospital itself. And the psychologists have been remaining working. We lost some of them. We lost their lives. And Al-Ubayr, for example, even in the siege, they have been working till now with no fund, with nothing, but they're still working and providing support. And I say that I salute all the women and all the girls and all the men, even the psychologists and mental health workers who remain standing, working without any kind of support, providing online services, on face-to-face services to the survivors, providing information, orientation, Costa Trauma Center, Al Gadarif Trauma Center, everybody and every psychologist. We are a tribe and we know each other, even people from other distance. So they're still working till now, and even newcomers, new graduates, now they are also collecting themselves initiatives on working and providing psychosocial support and mental health because it's a need and it's a crucial need for survival. The pillars of mental health should be actually also related to economic empowerment, self-reliance. It's not going to be something treated alone. It has to be integrated within all kind of services and all kind of interventions because it's the main pillars and it's actually making people more ready. People are relying still on the women in Sudan. When you talk about peace, then people are relying on us because we're going to shoulder this responsibility of building that peace. Officials, politicians build a peace on conference halls, but the peace agreements will never be translated without women standing in the communities, working and making societal peace. And even fighting with them most of the time, getting our space within peace negotiation is not just essential, it's crucial for those peace to happen. Still, they ignore our part and our role, that who will going to build the social peace, who will build the reconciliation, who will do that, apart from the women and women power and women interventions and women way of doing things, of women and restoring back lives and actually getting above hate speech and getting above ethnicity and tribal conflicts. So it's not just essential pillars, but actually a life-saving intervention. That's mean psychosocial support is not just treated as individual. It's or one things. It's actually should be integrated within everything. It should, yeah, and it should be integrated in all support and interventions. And because not only that, and because if you are expecting us to do all this, we have to be rehabilitated, and we have more strength to do this. I think it's time for Saudi as well. I'm keeping the red and green things. So I'm very adherent to your instruction, Azza.
Thank
No,
you
I'm
so much for
actually enjoying
sharing.
this.
Yes, we are. I wanted to follow up with you, Dr. Sulaima, since we're towards the end of the first half of the discussion. Before opening the floor for the participants and audience to ask their questions, you started already with demanding some actions from the international community. So, what else in terms of mental health and like collective well-being moving forward to the Sudanese people? What kind of actions are needed, and what type of support do we need from the international community and from us as Sudanese people to make sure that future generations don't suffer from generational trauma, but are having good mental health, and how we can support in making sure that they have better opportunities in the future and live a healthy life coming out of this war.
Actually, because I feel that collective healing is not the is should be always embedded within everything, and because women in Sudan, they need economic empowerment. They cannot be mentally well and independent and empowered without having economical means. The problem is of the economic empowerment intervention, they are always separate and they are not coordinated. And it always from the lens of those women are underprivileged and they're not understanding. So they give them training, a lot of trainings on how to make a living. And then they are not having any kind of profits. And they are not having any kind of capital. So how they are going to do this kind of things? And it's always a hit and run. It's not a sustainable things. What we need is economic intervention that actually based on the idea of profit. Look at the Sudanese women from the lens of economic power, not from the mercy and it's from understanding their position. The Sudanese women are very much could be considered as economic power. They are skilled, they could learn, they have adherence, they are business minded by default. They are trusted. You see in their any revolving fund, women are always trusted. Even banks, like the agricultural bank, they always trusted because they are always retain back their profit in time. And this is one of the traits, like it's a gender thing, it's a gender privilege, but actually how to use this to empower women. Women need revolving funds that's sustainable and actually also logical. And they need small capitals. They need sustainable projects that's actually having profit. If people see Sudanese women as a profitable resources, they will have a sustainable economical projects that's actually benefit the women, because we know that when women are benefited economically, the whole community will be benefited. We have the experience. We saw the experience of women in small villages and localities everywhere when they have projects and they have things they pay for the education, they pay for the hospital, they even rehabilitate the infrastructure, they give their shares within the community because they don't think only about their profit, but they think about their own communities because they feel that this is something for their communities and for their children and for the people in the community, because they want to keep the community intact and working and actually producing. Also focusing on productions. Women productivity is huge. Before the war, women 70% of the agriculture is actually made by women. But what women gain from that? They still die in childbirth. So So when you look at them an economic power, then they have an infrastructure to actually answer their needs, responded to their needs. Dignified health infrastructure, dignified roads. At least they have the safe roads they could walk. Because if you want about protection of civilians, protection of women, then infrastructure that support the protection of women, and then working on the security sector things. But this cannot happen if women are still, because I talk to women, a lot of women in displacement. We did a body mapping things also with women. And I think most of the psychologists know that's what body mapping is. And it's provide us like with the small quality, qualified data about like women's stories. And they always talk about they feel it hurts their feeling very much when they're still receiving things from people. Yes, we are in need and we appreciate what people bring to us. But actually, if you give us small capital, it will be much more better. And this is always their language. Depending on support all the time, this is not something they feel that reserving their dignity. So they always think about like how they could actually be part of the of regenerating funds or be part of regenerating. They also contribute, by the way. Yani even women who sells tea, if there is any initiative, they will be contributing. Women who sells tea in Shara al Hawadis, they provide money to Shara al Hawadis initiative from their own money. So they feel they have the privilege of contribute because they are economically independent and empowered. And this always should be accompanied at the collective healing, because all the community members need to heal. We always remember also the men who have been forced to see sexual violence or witness their family sexual violence assaults. And you see how much they feel, not only the men who witness, but also the men who have been feeling they are unable to protect or to contribute to their community. So the whole community need collective healing. Collective healing should be part of the policy, and every support, every initiative, every kind of projects and intervention should be under that umbrella, under the whole umbrella, biggest umbrella of peace building. And then falls it in mental health and psychosocial support, but collective healing because it actually answer and provide support for the 90%. And that might be we can about or then we can talk about the 10% who needs specialized support, and then having investing on more specialized support through trauma centers, specialized trauma centers, specialized addiction treatment centers. Because when you treat people from trauma, you find that they have been doing drugs, and then you refer them to drug centers. And because of the situation of the war, Sudan is still now a passage for migration. It's not just a passage for migration, it's also a passage for drug trafficking as well. It's not just human trafficking, also drug trafficking. Because the amount of drug now coming to Sudan, it's not meant for us. It's very expensive. It's meant for other countries who can pay for that. So we're still having this, we're still the road for everything. So imagine that. That's why people, as a negative adjustment for trauma, they will rely on drugs. They don't have means of living, they don't have education, they don't have anything, and then drugs will be an answer, if specifically if it's available and cheap. And the cheapest one, of course, not the so it's a crucial need for, it's a life saving. When I talk about mental health and psychosocial support as a life saving, I mean it.
Thank you so
I
much,
think
Dr. Iman.
there's other question you say as did I miss it?
No, I was thinking about the way forward, like the actions that we demand from ourselves as Sudanese people and from the international community. If you have anything else you'd like to add to that.
Investing on the formal system is always going to be one of the sustaining things. Because if you are not, if the international community is not supporting the informal system, then the protection system will collapse. If you see what happened to the child protection units, who have been supported by UNICEF before, and then you see them actually destroyed because of lack of rehabilitation, then the dire needs of the children inside, and the inability of families to come to report because of the distance. So investing in the formal system will actually enhance the protection of civilians and actually enhance things. And formal system is also include health system. Now the health system is actually all about primary health care, which is something very expensive, but we don't have any choices. Before in Sudan, the secondary the health system is secondary, so it's secondary, not primary. But because primary healthcare need a lot of money and it's expensive, everybody knows that. But actually, because it's nearby and it's close to the people, it's more accessible, and it could be used for, you can integrate reproductive health, gender-based violence support, and then also mental health within those primary healthcare. And geographically, it's actually very well geographically يعني their whereabouts, their geographically are very much distributed, and then you cannot ignore the essential roles of primary healthcare within community. And because of the stigma, you will fight the stigma through this, because everybody will come to the primary healthcare. Nobody will talk about you because you are coming to the health centers. Nobody will talk about you as a survivor or needing support for mental health, because everybody will go to the hospital or the community center nearby for essentials. Early detection of disability of children, everything could be happening within the primary health. And this kind of system, investing on that is always something that will yield good results. Supporting the whole, providing the minimum standard of support, like the minimum standard that's actually provided, because it serves 90% of the populations. But investing on its quality, like trainings, infrastructure, accessibility, advocacy, it always help and support. And because of يعني not only the health system, it's all infrastructure. Sometimes if you want to protect civilians, that you need to build, to rehabilitate a bridge, for example. To protect civilians, you need maybe a water point that's not getting them to risking their lives. To protect civilians, you need to rehabilitate a road to support the infrastructure of roads. To protect civilians, you need electricity. Those are essentials. You need water. Those are essentials. So all investing in any means of infrastructure, formal system, is actually investing on protection of civilians.
And Dr. Sulaima, if we want to start with even you and Saadia, because I believe a lot of people would like to reach out to you directly and explore how they can start with even small with collaborations, and then see and explore together how we can support the Sudanese community. How would they go about that?
That's why I talk about, look at Sudanese women as a prophet things. I just didn't want people to look at us from the eye of providing charity. It's actually about providing sustainable things. Economic empowerment is not just that. It's women should see how much their contribution to the national economy will benefit them, and how much people who are investing on them will get in profit. Because if people are not getting profit, by the way, let us talk numbers. If people are not getting profit, anything of any economic intervention will stop one day. We see that project, that people working in 60 months project for economic empowerment, and then they did not sustain it because the fund is not sustainable. And we need projects that actually goes for 3 years, not just 1 year or 2 years or 6 months. This is actually a very shameful thing to be, and it's in the middle of the support, then you stop supporting people because, okay, the fund is off, we cannot have the fund anymore, and then like in the middle of the road you left people. So what investing on doing humanitarian interventions should actually look at the lens of sustainable development as well. yes, you are responding to humanitarian needs, but actually look from the lens of development, because those investing on building sustainable buildings, for example, creating sustainable systems, creating sustainable system of localizing knowledge, creating sustainable system of getting localizing support as well. This is investing on people and human capitals. It's also sustainability. So if people look at us from the point of strength, not the weakness. Yes, we have been enduring war. We have been, and most of us have been survivors to ugly things, atrocities, everything. But look at us from the strength point. How investing on us would be benefit. How investing on us will be, and investing on the social capital, understand the people and understand their needs. And this will lead to how people could actually leading those kind of interventions and projects. And if we talk about women, women will not have a space if they are not looking for them from the point of strengths. Like, it gives them much more power, and investing on them is actually open a lot of new economic opportunities. Yes, you can do this as an intervention, humanitarian intervention, but should accompany people who are investors, people who want to invest more, productions, and contributing, because contributing to the international economy or contributing to the local economy will help the women as well, at least to provide sustainable support, it's health support, education, even localizing those women knowledge in a way that it could be sustainable for generations. And this is what help and support prevent also generational trauma. If women are much more healed, people are much more healed, they also have economic means, they are producing, they are having much more independence over their own economy. Actually, it's and they have a power of reliability. They are reliable. They could be. They have reliance. I mean, not reliable. They have reliance that could be sustaining those business when investors are not there. They have the power and they have the social capital that is strong and actually will always be remaining and resilient and building resilient city as well. Cities and that's actually can get can always be sustainable even if there is no funds. And how this could be resources, because we cannot rely on funding all the time. We know that the whole world is changing their minds about that, and it's a more of governments about weapons and about keeping their peace, and human rights is going to be very much something that will be ignored. And we see the future now, and we see some of the future things happening, but it's actually there's indication that human rights is not going to be the main things about it here, and all this advocacies, because now we see how much people are outspoken about their own safety and security, about investing in their own countries, and how are they people looking at migrants. And yes, we see that the whole world is changing, and so that's why we cannot all the time rely on funding, but we have to rely on how to create a local powers, that national powers that actually could get resources, and how investing in human capital is very essential.
Thank you so much, Dr. Sulaima. I also would like to give the floor to Mrs. Saadia so that she can also share with us the action points and demands that she has as a person who's on the ground working every day on community-based interventions. What would you like to demand from the international community and from the Sudanese people? What do you think that we can do first thing tomorrow, and what can we do on the long term?
Yeah, so Sulaima basically, mashallah, she said everything about what we need, what action do we need from them. So let just me summarize it in small points. We, as a humanitarian and as local initiative and as emergency room, the international community should look at us and should give us the trust. Don't stop treating us in a trial run, like we'll give you part of the fund, or we'll give you things to fill and then get back to you, and then we can do. No, we are now trusted. We are now the one in the front line. We've been working solely on this war for more than 500 days. We are doing everything. We proved that we are the front line, and we are actually the one who are the shield for the people, and we know our country, we know our community, we know how to deal with it, the best routes, we know how to do the actions. Not just that, we are able to educate ourselves. We look at the emergency room and how they are formed quickly after the war happened. Like it's just formed after the war. Directly people start working. What can we do? What the next step? How can we help? People are just start action. So stop looking us at and try to give us the power, give us the trust. We need sustainable funds. This is a huge thing. When you give funds for a month or two, or for 5 months, for example, and then we have organization who supported our community kitchen for 5 months. After 5 months, we have a community, we have 1,000 children relying on these daily meals. Then after 5 months, you will just tell them, after they've been stopping in line, after they've been walking for miles to reach this kitchen, to reach these daily meals, after the families think that, okay, at least we have a stable meal for our children, then we tell them, unfortunately, the funds stopped. This is unacceptable. And they should be, and this is lead to a next step. There should be accountability. Like you cannot just make just offer funds and then you stop it, or try to do actions and not counting the what's consequences happening. Also try to adjust. You need to adjust your system based on what happened in Sudan. For example, I'll give you an example of some organization that providing help for a specific type of people. Like they will say, okay, you can just provide this service for this specific type of people. What about the rest of the people who are actually facing the same problem? Just because they are not under your scope that you made for yourself, that means they are not eligible. You cannot force your this system on us. We are the this is you are all living in this world, and you need to start treating us doing this action to us, and respect what's happening to us, and try to deal with it, because we're living in a single world. If you think what's happening in Sudan will not affect other communities of our, you are mistaken. Everything happening in a part of the world will eventually affect. You see how many immigrants right now, Sudanese immigrants we have. You can see how much we are talking about outbreak of so many diseases that can eventually go outside and reach other countries. So you're not living, okay, we are not just you're not living this bubble, we are living all together. So don't expect that what's happening in our country will not affect you. We need clear demands. We have clear demands. We need faster humanitarian access. We need safe routes so we can work through it. We need funding pathways that reach local actors directly. We need accountability mechanisms that ensure aid is not delayed while communities are facing famine and displacement. The whole world should try to deal with this humanitarian crisis, and don't stop. Don't just stand still while there is the worst humanitarian crisis happen in the world. Don't turn your back onto us, because eventually we will get up. We are standing up. We are trying to do what we can, but we will not forget that in the process we lost lives. In the process, you turn your back on us. This is not acceptable. So the cost is high, and it's happening right now. The problem is happening right now, and at this moment and every day. If you're not doing an action, it's gonna be worse and worse. Yeah, thank you.
Thank you so much, Mrs. Sadia, and thank you, Dr. Sulaiman, for such a rich and real discussion. I would like to open the floor now for our audience. If anyone has questions for our guests, feel free to raise your hand, open your mic, and shoot your question. We can also check the chat to see if anyone sent a question earlier, and we can also answer that.
Hello? Hello?
Hello?
Can you hear me? My chat is, for some reason, is not functioning, so I took the chance, Asa, and just put up my hand here.
Yes, please go ahead.
Well, I just want to share that my deepest respect and admiration for everything you have told us. And I mean, if there's one thing I think we understand extremely well, it's this is not a bid for charity. On the contrary, you are presenting this in such a strong and also very powerful way. So I wish, I mean, I'm just full of wishes that that things could be followed up. I'm myself a psychologist. I've been working with refugees for many years. I'm retired now, but I was especially taking note of the willingness that both of you have spoken about for women to help each other in situations where they have been exposed to severe violence. And I mean, we know that being meaningful for others is one way of dealing also with one's own trauma. But of course, the support that they give is extremely important. But I was thinking that it comes to a point when they both have received a lot of pain and they give a lot of support. Do you also see that some people just they cannot carry the weight anymore? And what can you do then? I'm working together with Elizabeth Langdal, who had to leave in what we call Mental Health and Human Rights Info. And we have collaborated with colleagues from Sudan for many years also earlier. And one of the things that we are very concerned about is how to support those who are helping others. So I was just thinking, how do you deal with that? Because even for such brave people, there is the limit that they feel that now I cannot anymore. How can you support them again then? They have both their own trauma and they have given a lot of important help to others. But thank you so much for everything you have shared with us. And I wish the whole world could listen to every word that you have been saying, because you're quite right. It's the world has to wake up, and it's sleeping. Thank you.
Thank you, Nora. And I believe this is a question that Dr. Sulaiman can help us answer. Dr. Sulaiman, can you hear us? You're muted.
Yes, I can hear you, but because of the internet is not very stable, I'm not using the video. Actually, yes. It's because of the trauma people are feeling. And I think the Sudanese people reaction to trauma should be something studied, because what we've been studied in university and would be has seen classically as traumatized people. It have been we have seen another examples that actually all the time we feel amazed by it, because people went through the pain and then they didn't have time to process this pain, and when they went and grief, because in grief you know that you have to go through those stages, and even in sexual violence it's you feel some kind of grief and all losses. But then you in the middle you find those people are just surviving and are just leading their normal life, and and actually think about others. Like, I will give you just a story of one of the survivors. She has been trying to get the girls in the house, her nieces, her daughters, and even her cousins, because they are younger than her. You see, in Sudan, when we reach the age of 40, 30 something, at end of the 30s, sometimes we feel that we are immune to get any kind of encounters and unwanted encounters. So she feels that she's not going to be attacked. She can help the others. And then she was the one who has been actually targeted. She was gangly raped, and every bad things had happened. For 2 weeks, she couldn't eat anything because she smelled the smell of the perpetrators all the time. And after 2 weeks, I get the contact to her, and then we contacted her about like she has to go out of the place where she is, because in that place she could not get to the medical support. She will feel that she's been watched by the community. Then we evacuate her to another state. I was calling her every day sometimes to make sure that she met with the psychologist, she met with the doctors, she get everything and support. The moment that she felt that she's fine, it was only after meeting the counselor for the second time in a 1 week. She said that, you say what? I'm fine now, but that my daughter has to go to the university, but I have to travel to Egypt so I can register her in university, making sure that she's staying with her aunt and she's okay, and then I will get back to Sudan. And I was like, I was speechless, because I was feeling very bad for her for what she went through. And I think with all the stories I got, she's one of the most horrific stories. And I couldn't say anything, because I even me, I was astonished by the ability. I don't have that capacity. I don't feel I have this kind of capacity, but she is. She just went and go, and I think it's something that should be studied, because it provides different examples of resilience and different example even of reaction to trauma. And even that's will, because this will contribute, if you understand the way that people are doing things, we can understand how they could actually, how effective the intervention for trauma could be actually appropriate, because we come with our classical knowledge of trauma, and we know the process, and we talk about normalizing saying things, and you give orientation. If this works, yes, but actually, if those people need more in traumatic interventions, is this everything that we studied and been practicing, is it going to be appropriate for them or not? And this has always remained a question for me, because I feel like the 6 week things, 4 weeks things, it doesn't work. I see that maybe your butterfly thing, you are one of the butterfly authors. And I see the butterfly things could be working, because it's more of self-help. And you know what we did with it, and Ahfad, you know how much we change a little bit the metaphor. You know that. I guess you know that. I think they have been speaking to you about this.
I think so, but if you
And
can say, yeah,
yes, I can say it again, yes.
because we did go to
Because
Africa and talked about it.
yes, yeah, we appreciate, of course, we appreciate the butterfly as a resilient creature. But because if we talk to simple women in Sudan, butterfly, or in all Africa, butterfly is it's just a fly. It doesn't have that kind of metaphor. So we change the metaphor to the veil, like, because women wearing colorful veils, or It's actually some kind of resilient to them. It's very good. They feel very happy when they're doing this. And it was embedded in a book called Sakina. Sakina means serendipity in Arabic. In Arabic, Sakina is in English, it means serendipity. And the name itself provides some kind of support to the people. So we call that book Sakina. And the main thing is about the colors. That's when we changed a little bit of the cartoons that to make it without colors before. And then when she's getting support and she's changing, we add colors. And then at the end, it was a colorful veil that's carry on joy, dignity, and strength. So you see, sometimes we have to moderize things to suit people.
So moving to hear this. Thank you so much. Yes, go on.
And we still keep the butterfly in our heart, and we still look at your manual all the time, and we still appreciate what you have been doing. Thank you.
And thank you. This is more than I expected. I just wanted to share my very strong both concern and solidarity with you. But thank you so much. This is impressive.
Thank you, Laura. Thank you, Dr. Suleima. The floor is open if anyone else has any questions they would like to ask our guests.
I just wanted to add that I saw this in our the workers. You know, how we started this work is from the people themselves. They wanted to help. So we're talking about displaced people. We're talking about people who survived massacres. We're talking about people who survived lots of things, and they are coming and they wanted to help. They reach you and they say, "What can we do? Just we need to do something." People in Sudan, they don't want to stand still. They want to do anything. We have this in our culture. We have the takaya, which is what nafir, and all of these terms. It's not just, it's built on us that we have a nature of helping. We have a nature of resilience. We have a nature of doing a lot of things. We don't want to stay without doing anything. I saw it on people who lost everything and yet provide something out of nothing. So this beautiful thing is showed us what we really are. You know, we've been through a lot of things. We never thought that we can survive, and yet this is the third year, and miraculously we are surviving. No, I don't think, you know, the thing we've been through. It's very hard, you know, to stay and until this day and try and become stronger, and you still want to help. And I want to say also that even the people who are providing the help, even the workers, even us, even the people who are reaching from beyond, we need also some sort of support because we are facing a lot of things. And how are we doing this? We're surviving day by day because every day we face a problem. Every day, I will not say how many times I faced with a case of someone we lost. You wipe your tears and we move on to the next case because we have more people to support. So if you just do enough with the negativity, you will not continue. You will just stay in depression and you will do nothing. Thank you.
Thank you so much, Saadi. And I believe I can echo this because as a Sudanese person living outside Sudan, having the privilege to be living a normal life, and there's this sense of guilt, you know, that you're surviving, you're away from this. So I believe like Sudanese people, I think inside and outside Sudan are facing difficult challenges. It's not the same, but it's difficult all the same, you know. I see Miss Ante, if I'm saying the name correctly.
So it's Anne Ferden. I'm from Norway. So this is my first time, as I wrote, listening to this. And as Noora said, I'm just extremely impressed. I know that doesn't help you, but just to hear your voice. And I think especially because I have had more to do with Ukrainians and the Gaza situation. And as you said, it's we cannot forget you. And somehow, I mean, 3 wars going on and things, that is, I think, a danger because it's further away. But I have joined it at the moment. I don't know what I can do, but at least I've been listening to you. And I think one of the things that I take with me is this strongness, the way you really put words to your needs and not the charity. And also, as Noura was saying, I mean, the strongness and also the community kind of keeping together of the women, which I think I haven't heard in such a strong way, I think, neither from Ukraine or from Gaza, where the individual may be at a more somehow you don't have the same kind of grouping of the tragedy. Maybe I'm wrong in that, but that's my impression. So this is something that I bring back, and I think I will see what I can do, but we can only do this much. But at least just listening to you. So thank you very much.
Thank you so much, Anafe, for your contribution to the discussion.
Thank you.
I don't know if I'm missing anyone else raising their hand. If so, please unmute your mic and feel free to join.
Meanwhile, until someone join, I want to say that I've learned the strength from watching all the women generation. We are Sudanese women are a generation of a very strong women. You will find your ancestor working on the field. My grandma was a strong woman who was working. She was a widow and she had lots of mouth to feed. She worked in the field, she worked in the market, despite it's very hard to work among all of these men, but she was so strong, even men felt intimidated by her. My mother raised us in a very strong way, like she will do anything to protect her children. She will do anything to provide for them. So when I look at a woman carrying her child in her back, walking for days, trying to protect her children, trying to feed them before she even put things in her belly, trying to do whatever she can just to support her children. When I see women protecting their young ones, I've seen women protecting their young boys during the massacre. They dress them into girls' dresses so the RSF will not kill them. I've seen them taking off their clothes and put it on their children. You will see a woman doing anything just to support for her family. Very strong. They are working in a very hard condition, and they doing this day by day. They are not knowing what will happen tomorrow, but they are very strong, and I look up into them, and that's why every day I woke up looking into them and thinking, I will not give up, I will not stay still, I will do something. And I believe, Anafe, you can do a lot for us as Sudanese, just like you did for Gaza and you did for Palestine. And I salute you for doing all of this, because this is for humanity. Every life count, every life matter. So you can do a lot for us as well, even just by listening to our voice. Thank you.
Thank you, Saudia, so much for this. And I think I have a question for you in the chat box. You mentioned earlier on that there is a big gap in the support that is being promised by international bodies, organizations, and the reality of the support that is actually materializes. Are there any steps you would recommend we can take to try and resolve this and close this gap, ways we can hold these organizations accountable and ensure they uphold the promises they are making?
Yes, the power of the people. Your voices are heard. If you are in this country, you can reach to these people. You can send emails. You can even, make campaigns to, or you can just speak. The social media will reach you, connect you to these people. So when we talk about, for example, like the WFP, the ration they are providing for a family, and in Sudan we are big families. So we are a family of 9 people. We're not a family of 3 or 4. We're a family of 9. That's a single family. So when you provide for us a ration that will not last us for 2 weeks and say this is your ration for 2 months, this is not correct. This is not what you should do. Taking pictures and showing all of this massive amount of food going, and actually it's not reaching, it's not enough. Supporting these their accounts, even in their accounts, if you can talk about this, even if you are reaching through emails, even trying to help them accountable, at least show the truth to the people. We have power, we have lots of power. That's why I said, if this war happened in a different age where there are no internet, there are no connectivity, there are no social media, would have just been wiped in silence and no one will listen to us. At least now some people hear our voices from Norway, from UK, from all around the world. People are listening to us, people are asking, what can we do for you? This is a luxury. This is something, power we have. Let's use it. Let's try to do something. Let's educate other people about what's happening in Sudan. Even if I cannot do anything, I take a responsibility to educate the other people about what's really happening in Sudan. I have a news, I have information, I will share it, because sharing this is giving a power to the people. And now you can have some action. You can donate, you can offer your service, you can, you have your connectivity, talk to other people, and all of these are action you can do. I told you about the small business and how they are offering their small profits. It's a small amount of profit, but at least they are offering them to support us. Let's imagine all of the big business doing this, then we will not be in need.
Thank you, Saadi. And I second that. I believe even just talking about what's happening in Sudan, resharing hashtags and sharing stories and posts from Sudanese influencers who have been posting daily since day one of the war until today, sharing what's happening in Al Janina, Al Fashir, and all over Sudan. I think just talking about it daily would help people not forget about what's happening in Sudan, would reach more people. People will be curious to know more. They will go to these accounts and explore ways they can help. We try to hold these spaces and we'll try to do it more often so that we can reach more people, and you can help us by resharing this dialogue and talking about what's happening in Sudan in many ways. I believe just you paying attention to what's happening, wanting to help, and sharing even a post would matter. So just even this small act would mean a lot to the Sudanese people. Do we have any more questions, or anyone would like to contribute to the discussion in any way?
Yeah, Asa, this is Tiffany Jimenez. Hi.
Hi, Tiffany.
Hi. I don't know if you saw my question in the chat. I didn't want to take up too much space, but I did wonder, I heard that economic resources for women collectives might be the most helpful strategy for those where we can offer those things. And I'm looking for very specific ideas for any recommendations that could be developed by national organizations, and particularly how academics that want to put university and professional association kind of finances to the service of the women. How can we do that? Any creative ideas, I would be happy to communicate to any of our own professional associations. But I was just listening to what people were saying, and I was also thinking, well, yes, we want them to be able to capitalize on the kinds of funds that they get, but maybe not within the traditional economic pathways that exist and contribute to the broader forces that continue to perpetuate the violence. So if there are, I'm just kind of thinking too, like maybe there are international economic places where we could invest on behalf of the women with their say, of course, where they can, create more or let the money work for them. Do you see where I'm going with this?
Yes, and I believe Dr. Sulaima talked about this in the discussion, so maybe she would be able to share her input. Dr. Sulaima, can you hear us?
Yes, I actually missed the last part
Sure. So
because there was connection, there's something.
Tiffany was
I missed
asking
the
about.
sound.
Sorry?
I missed the sound. So there was no sound for a while when she
No
was
problem.
Tiffany. Yeah,
Yes,
if you
Tiffany
repeat
was
the last part.
asking about ways of. Can you hear me now?
Yes.
Okay. Tiffany was asking about ways they can help with economic empowerment of women and maybe non-traditional interventions and how they can direct funds from different entities and academic entities into supporting women of Sudan. Tiffany, if there's anything I missed in translation, you can also add to that.
Yeah, I think also thinking about the international or global context that is participating in the perpetuation of the violence against women in the region. And so I'm just aware
Yes.
that there's going to be some overlap in that, and that we probably want to find alternative ways of creating economic support if that's possible. So I'm just curious if you have specific ideas.
Actually, Stephanie, thank you for your question. I'm not an economic expert, by the way, but I know that from the resources of Sudan, there's so many opportunities. It could be very natural resources, meaning that's working on agricultural production, and that's when you work in agricultural production, that's mean there is a food processing, there's other thing related to the manufacturing of food itself as a business, but also there is mining opportunities, which is always limited for women. But actually, I know that if people investing on women on this kind of business, they would be great. It doesn't mean that they're working in harmful condition where they are exposed to the harms of mining, but it's still an opportunity and it's still a land for that and still a spaces for that, and it's an opportunity that located within local communities, and there's still production coming for livestock, and there is always going to be the cultural business, like the cultural productions. People invest and put a lot of money on this kind of cultural productions. And Sudan has a very rich diversity that actually their cultural production could be invest on it and then could be getting a lot of money on that, because the fine things they have been actually manufacturing, doing. When you go to the Ethiopian airport or your Kenyan airport, you buy the products there. It's beautiful. And I'm sure you that Sudanese women and the Sudan history and heritage have, and because of its diversity, they have much more of those cultural things. But actually, people do it as a small business and it doesn't work. But if you're investing on its quality, and that's making much more business and productivity for it. And this production should be exported يعني exported commodities, because we sometimes we import things that we don't need. It actually could be manufactured in Sudan by the women of Sudan and or the men in Sudan, but actually we have a lot of resources that are not used. And there's so many opportunities within each production. Like if you talk about like you're producing tomatoes, for example, there's so much productions related to tomatoes. If you are talking about producing, there's women who are selling herbs. There's very natural and very rare herbs in Sudan that's actually getting into a lot of manufacturing of medications. And that's anything kind related to manufacturing of pharmacology yield a lot of money. But those women, when they sold this kind of things, they sold it very cheap. They don't know its own real cost and how much it could be used and for the whole world. And we can talk about the Arabic gum. For example, women who shall cut the Arabic gum, they get nothing. There are places where the same amount they sell with $2 could be actually sold in France by the same amount by $10,000, the same amount, you see. And you see the under the injustice. Those women who do this Arabic gum have no hospitals, have no access to any kind of support. They took only those $2, and sometimes their husband, for example, let them work, and then he got the whole money at the end of the day. So you see, there's a lot of opportunities if women are empowered and there's a real business invested on them, like put more social capital, more capitals put onto enterprises, and more of small, not just a small capital, but also investing on different things in Sudan because of its diverse climate, because of its diverse production of different plants and different productions, and because of things, because in the Red Sea, there's a lot of opportunities to work with women of the Red Sea content itself. People are not using that. They're not using, because a lot of people are now exporting the fish powders because it's good for fishing, and they need it everywhere in the world. It's much more natural and much more organic, and people are producing it in small scale, and they don't know it's real يعني real prices. So they sell it very cheap, and it's good for fishing everywhere, and I can tell you about other southern opportunities, but because of economy, it's not my arena. I feel that I'm just giving them injustice, but I know there's a lot of spaces, and I really want Sudanese women to focus more on production because we lost a lot, and even lost a lot of production sites. That's we need to renovate those sites, and we restore those production sites. We need to have women on board on that, but like their power is much more like they're the center of this production, they're the center of every economic interventions. I don't know if I answered your question because I'm not an expert, but actually if I find anything, I could send it to Azza, and and share it, and she can share it with you later.
Yeah, that would be great. Yeah, I just feel like we need to keep this conversation going. I live in Chicago in the United States, and VJ Prashad was here yesterday talking about different ideas for organizing for different folks in different places. And so anyway, I just think there's people maybe we could even turn to for consultation on this issue if we wanted to. But thank you. That's very helpful to hear all that.
Thank you, Dr.
Thank
Salome. I
you.
think also Sadia would like to jump into the
Yes,
conversation.
I want just to provide stories from the things we have done. You know, we have attempt to empower women, and we have survivors. We are empowered through two major work. One of them is producing juice. Juice. So we just provide for them. We taught them how to provide, how to make the juice, and then they sell it. And this is one of the project. Another thing is our perfume. We are famous with making perfume, and a special type of perfume. We also teach women how to do it. Also, I want to say about the people in Sudan. We also we did some projects in farming. Some of them we provide with the seeds, you know, and some with the watering system. So, and they have successful production. So we have successful stories. Our country is very rich in resources, just like Suleima said. We are rich in agriculture, in terms of anything, making anything, even if the livestock. So just, you know, all right now, because the country itself is still developing. So and because of what's happening, like we have a lot of destructions, and we need to just rebuild the country itself. So right now we're focusing on this cash income projects that will bring directly to the women, because we're focusing right now on just feeding them for the upcoming month. Then when they are self-financed, stable financial, then they can go from there and have their own projects, and they can have their own work, and from there they will be independent, and more and more will join. And these are amazing projects, but unfortunately the big organizations are not focusing on this. They're just focusing on just providing food. In terms of food, they don't want you to grow your food and then you are self-sustained, because this is what they work. That's how they do it. They should be a need, so they can have they work, so they can have their admin cost, they can have their way of profiting out of this. But for us, I'm gonna give you the money, I'm gonna teach you how to do it, and then you will be independent, and then you can teach other, and then I have less burden on me, and we can all become a successful community. We have communities, we started investing on them, and they are now much better. Malnutrition is less. Students are now children are now in the school because there is meals provided daily. They are we are providing them with materials for school. So people are now willing to send their children to school because they know they will have food, they will have materials, they will not need to worry about all of these things. So from there we can rebuild our small communities, and then start and grow bigger and bigger. Yes.
Thank you so much, Sadia, and thank you, Dr. Sulaima. I believe you both talked a lot about sustainable support and how we can support the people to have something that they can then generate income from and help sustain themselves and their communities, which is great. Sulaima, you wanted to say something?
I think I need to say something to wrap up what I have been saying in some points, like because we have to make sure that Sudan does not need any fragmented solutions. It has to be integrated all the time. It needs integrated, dignity-centered interventions that see women as peace builders, economic drivers, agents of healing. And because when women heal, economic recover, and peace stops being an aspiration and become a reality. And because I feel that women could be translating everything into actions, they need investing a huge amount of support on women. Thank you.
Thank you, Dr. Sulaima. Thank you, Mrs. Sadia. I would like to sincerely thank you both for the generosity in sharing your knowledge, your lived experiences, and your critical insights with us today. We're especially grateful for your willingness to lead this important conversation in English to ensure broader accessibility and engagement with our audience. We'd like to thank everyone who came today and who came with open mind to learn more about Sudan and explore ways to support the Sudanese community. We really appreciate your presence, and we hope you continue conversation about Sudan and share hashtags, keep up with daily updates from what's happening on the ground, and wish us luck in the future of Sudan.
Thank you so much. Thank you, everyone.
Thank you so much. Thank you. And we wish you just all the best possible, and we will stay in touch. Thank you so much to all of you.
We will share the recording and the contact information for our guest speakers with everyone who registered for the conversation.
Wonderful.
So that you can keep the conversation going. Thank you.
Thank you so much. Okay, bye-bye.
Thank you all.
Thank you all.